Can you imagine a world where your mind constantly dances from thought to thought, where focusing on a single task feels like trying to catch a butterfly with your bare hands? This is the daily reality for millions of people living with ADHD, or attention deficit hyperactivity disorder. The first question that naturally arises is, who is at risk of developing ADHD? While there's no single cause, a combination of genetic, environmental, and neurological factors can increase the risk. It's not a respecter of age, gender, or social status. It can affect anyone. One of the most contentious issues surrounding ADHD is discipline. It's important to remember that a child with ADHD isn't being disobedient or difficult on purpose. Their brain simply works differently. Understanding and patience are key in dealing with disciplinary issues. What are the signs and symptoms of ADHD? They're often divided into two categories: inattention and hyperactivity impulsivity. These can manifest as forgetfulness, difficulty following instructions, fidgeting, and impulsive decisions, among other things. While there's no cure for ADHD, there are treatments available that can help manage symptoms. These range from medication and therapy to lifestyle changes and support from loved ones. Beyond traditional medicine, there are alternative treatments that some find helpful. These include biofeedback, yoga, and dietary changes. Speaking of dietary changes, there's a growing body of evidence suggesting a connection between nutrition and ADHD. Some studies suggest that certain foods may exacerbate symptoms, while others may help manage them. The ADHD brain is unique. It's not defective or broken, just different. Understanding how it functions can help us better manage the disorder and support those living with it. It's also worth noting the potential link between chemical exposure and ADHD. Some research indicates that exposure to certain chemicals during pregnancy may increase the risk of a child developing the disorder. Despite the challenges, many people with ADHD lead successful, fulfilling lives. There are strategies and tips that can help manage symptoms and harness the unique strengths of the ADHD brain. Finally, will ADHD ever go away? The answer is complex. Symptoms may change over time and some people may outgrow certain symptoms, but many will continue to experience them into adulthood. In conclusion, ADHD is a complex, multifaceted disorder. It can be challenging, but with understanding, treatment, and support, individuals with ADHD can thrive. It's not about curing the disorder, but learning to live with it, embracing the unique perspective it offers, and celebrating the strengths and talents of those with ADHD. Remember, it's not a disability, it's a different ability.